Welcome to This Week in Health IT News, where we take a look at the news that will impact health IT. This is another field report where we talk to leaders from health systems on the front lines. My name is Bill Russell, Healthcare CIO coach and creator of This Week in Health IT, a set of podcasts, videos, and collaboration events dedicated to developing the next generation of health leaders. As you know, we've been producing a lot of shows over the last 3 weeks, and Series Healthcare has stepped up to sponsor and support This Week in Health IT. And I want to thank them for giving us the opportunity to capture and share the experience, stories, and wisdom of the industry during this crisis. If your system would like to participate in the field reports, it's really easy. Just shoot me an email at bill@thisweekinhealthit.com. Now, on to today's show. All right, sounds good. Today's conversation is with Steve Leblond, CTO for Ochsner in New Orleans, out of New Orleans headquarters. Steve, welcome to the show.
Thank you very much for having me.
Well, I appreciate you taking the time. I know that you guys are extremely busy right now, and everybody is really busy. So I'm just going to get straight to it. Actually, before we do, give people a little idea of your organization. Its scale, scope, reach, those kind of things.
Sure. Ochsner Health, we're the largest employer and largest health system in Louisiana. About 26,500 employees, give or take. A little more than 2,400 physicians and or advanced practitioners. So fairly large health system, large IT shop, 650 people or so. Maybe not the largest, but fairly good size.
Yeah, give us a little idea. I mean, you guys are starting to surge at this point. I'm looking at all the numbers, all the different states broken down. There's a great model out online I'm using, and it looks like New York is definitely right in the thick of it. You guys are surging right now as well. Give us a little context of what your system is doing around preparation and serving your community.
Yeah, absolutely. We are definitely surging. I think per capita wise, we're just as bad as it gets for the world right now, which is unfortunate. But we basically have 4 different pillars that we're working on as an organization. A community pillar, expanding, certain things to help our community during this time. Expanding our ultimate containment strategies, like what are our containment strategies that we have as an organization to contain the spread of this? How do we expand our testing capabilities? And then lastly, how do we expand our care, the care that we can give? And under each one of those, we have elements that we're doing. If you look at like our community focus work, we've stood up our daycare center, which we did in, I think, 2-3 days, daycare for 1,500 employees, children. So, how do you stand that up quickly? Because as people start losing jobs in the service sectors, that impacts your patients and that impacts your employees. And now all of a sudden, a lot of people might find themselves as a single income family, or the daycares have shut down. So how do they, if they're a single parent, how do they get care for their kids? So you've got to think on that community level and not just on your normal day-to-day stuff. With our containment work, we've done a lot of stuff. Obviously, a lot of folks became teleworkers overnight. As you can see, I am one. I'm here in my home as well. So how do you support 4,000 teleworkers who are working in the office, and on a Friday, they're all working from home? So how do you do that quickly and seamlessly for them so they can continue to take care of our patients and take care of our organization? Testing's interesting. We did a lot on testing. One of the things we did, we developed our own in-house testing capabilities. So I don't know if everybody's doing that, but when you're reliant on commercial testing from external places and or the CDC, the turnaround time on that can be several days, and they got inundated with that. So we've done that, stood up our own testing, been doing that for about 2 weeks now, which is great. So expanded that. And then last on care, lots of new ICU beds expansion. We stood up, my team and some others actually stood up 50 new ICU beds in 2 days. So that's impressive to put all that equipment in the rooms, get all that up and running. They're working around the clock, but we expanded 84 total beds within a week. So all that's the work that we've been doing.
Wow, it strikes me as you're sharing those things that the communication within your organization sounds like it's really well thought out, and that you guys are communicating really well. Can you give us? I'm already jumping off the questions that I normally would ask, but can you give us an idea of the communication structure that you guys are using to make sure that everybody's informed?
Yeah, absolutely. And I think that those that aren't getting hit hard yet, you will need to think this through. I think communication, and ultimately it's the elimination of confusion that you're after as a leader. The elimination of confusion is going to be key as you go through any crisis. And so we've got, I wouldn't say over communication, but we've got a well-structured daily huddle with every director and above from an IT standpoint. So we meet every day in a daily huddle for 30 minutes to go through our day's response. We moved to a 7-day-a-week schedule to make sure that we provide, support throughout this crisis, because Saturdays and Sundays where IT, some IT folks had that off traditionally. When you're in this crisis response, you're going to need to work throughout the weekends as well. We have a response center that's set up, so it's sort of like your command center, but we call it a response center to coordinate our response. And then when you talk about that communication, putting in those contexts of those pillars becomes important for your senior leadership, because if your individual contributors, they're going to be working on lots of different things. We have a list of 100 things that all of a sudden new work they're getting pulled to. And if you can't eliminate that confusion and show how that aligns into a greater plan, and you're moving forward in that greater plan, you're going to start to suffer from poor morale. And you can't have poor morale with a large team as you go through a crisis. You need to work on that as a leader and work on your communication.
Yep, absolutely. So, what's one thing you've discovered over the past few weeks that might benefit others? I mean, since you are further along in the surge, what's one thing that sort of stands out that you've learned?
I think the scheduling of the team is actually important. It might not be the most interesting answer maybe when you go through your interviews, but scheduling your team is going to be important, because as you go through a real surge, these numbers that you see on TV, they're not just numbers, they're real people. And those numbers are going to start to impact your caregivers, and they're going to start to impact your IT team. So what is your plan as a leader as your IT team starts to get sick? Because your field techs, your people that are on site, your asset teams, they cannot not show up to work. They're healthcare workers first. And as they're on these floors, and as they may get ill with either the coronavirus or any other virus, and they go down, what is your plan? So how do you schedule for that? How do you plan for that? How do you keep an engaged workforce that's still willing to be on that front line? So that's an interesting thing for me. I don't know if it's the most interesting answer that you may have heard from others, but that's something we spent a lot of time on, making sure that when people do go down, we have someone to come in. And you got to keep in mind, this is a long-term thing. So if people think this is a 1 week, 2 week thing, it isn't going to be. This is going to be 2 to 3 months if you're lucky with this sort of staffing plan, and it's probably going to be longer than that. So you got to really think that through.
Yeah, we're going to have COVID-19 around for a while. I think the surge, as we're looking at the numbers, surge looks like a 2 to 3 month kind of thing, and it's getting people into that mindset. I'll tell you why that's an interesting answer, because it's not one I've heard before. And we've done a fair number of interviews at this point. But the scheduling is really interesting to me. And then one of the things, and I guess I should have thought about this, and maybe if I was in the chair, I would have thought about this, it's keeping health IT people safe. Now, we're in the business of helping the caregivers stay safe, and I've heard people, putting iPads in the room so that caregivers, can actually take care of patients without going in as often and those kind of things. But I hadn't really thought about keeping the health IT workers safe. Is there like training around that, or are we? How is that being done?
Well, at Ochsner, everybody gets trained on their orientation. And when this crisis broke out, we sent out and retrained everybody as well. So everybody's got training on PPE. And then every IT staff, we divided our IT staff into two, on-site and virtual now. We have, on-site, we probably have 100 or so folks, virtual 550. And all the on-site folks have like masks. We make sure they all have a mask so when they need one, and to use proper PPE when they go in the room. Our solution is, you got to keep in mind, like, we're healthcare workers first, and that's what everybody knows. And we're not going to negatively impact the care of a patient because somebody is like afraid to go in the room. We have the right tools, we have the right equipment to protect our IT staff, and we're going to do that. However, when people do get ill, and when they do get ill, whether from a work exposure or from, a general community exposure, what is your plan on that? Because you might, if one person goes down, that's easy to backfill. But what happens when 4 people on a 6-person team are ill and out for 2 weeks or under quarantine for 2 weeks? What's the leader's plan then? And so from a resource standpoint, you got to make sure you're still very effective in your actual ability to solve the IT problems of the organization.
Yeah, I do. So, what's one thing that your team has been able to do that we would be most impressed with? And I sort of coached you ahead of time to say, everybody's talking about telehealth and expanding work from home. Those are really impressive. So if you want to talk about them, I get it, because it's, what we've done over the last couple of weeks are amazing. But I'd love to hear, practically, how did you pull some of that stuff off?
Believe it or not, a lot of stuff we had already done, a lot of groundwork for. So when 4,000 teleworkers go home one day to work, we already had remote connectivity capabilities, really good infrastructure, really good bandwidth. We were, lucky at all those events that we had, sort of planned and thought about that. Being on the Gulf Coast South, we're always ready for a hurricane, and so no matter what month it is, and so you're always ready to, like, if you have an extended work from home situation. So those were good. But some of the things I think that we did that might be a little bit unique, and or maybe people aren't thinking about them right on the top of their heads, is your telehealth solutions are going to expand. And they expand, I think, in a different way, where before, you develop the solution, you put it out there, you get buy-in. The opposite suddenly happened like this. Now we have 26,000 people who are coming up with telehealth solutions, and they're hitting us with them saying, how are you going to solve this problem, this problem, this problem? One of the solutions that I thought we did a really good job on was virtual patient visits. Not for the provider, and that's where most people are going to go, but for the patient and their family. Because when you go into a crisis situation where there's a pandemic, we're limiting visitors. And you have very ill people in hospitals, and not everybody, is ill with COVID-19. You have terminally ill people sometimes in hospitals. And so what are you doing to enable them to continue to visit with their families? And so we actually, we went low tech with it a little bit. We went with some older tablets that we had with some Skype accounts, generic Skype accounts, and we bring those to patients so they can at least do virtually visit with their loved ones, because right now we have restricted visitor policy. So you've got to think that through and plan that out and come up with a solution that's somewhat scalable. And it becomes doubly hard because getting hardware can be somewhat challenging for that. I myself actually drove around and hit all the Best Buys. Shout out to Best Buy here in the North Shore. But I picked up 31 Best Buys, 31 iPads over 3 Best Buys that I hit that we used for some of these use cases. So you got to get a little creative, especially as you're spanning these solutions quickly.
Yeah, and I heard that from somebody. I didn't interview the person. I was talking to them on the phone, and they said they placed a massive order for stuff, and they just went down the list until they found something that was in the inventory, and that's what they got. They got a tablet that was available that they could do this stuff with. It's amazing. But you're a CTO, so I'd be remiss if I didn't ask you about scaling. I mean, we're scaling at a rate that normally a CTO would sit back and go, hey, give me a little time to scale this. I know you put some of the stuff in place, but you still have to worry about latency, bandwidth, capacity within your data center, security, and other things. Talk a little bit about scaling this out and how you approach that.
Yeah, I mean, we have flexibility already. I think any technology leader, CIO, CTO, or otherwise, if you're already at your cap of what you can scale to, like on your regular day, you already have work to do. So if you have a 1 gig max internet pipe because your routers are limited or your WAN router is limited, that's something you need to solve now, not when you're in the middle of a crisis. So we were lucky that we had that scalability built in. Now we didn't have, we have a 5 gig internet pipe. I'll probably bore some of your users here if I start using too technical language, but a 5 gig internet pipe, but we could scale it to 10 gig, and right now when we moved all those folks from home, they only peaked about 40-50% of our pre-existing internet bandwidth, but we were able to easily scale it to 7. So with regards to like our turnaround times, I would sort of turn around a little bit on both yourself and your customers. Like you need to be the IT team that your organization needs you to be. And right now we need to be fast. That's part of it. And so not every project management process that we have in place to manage our work, not every normal turnaround time is acceptable anymore. And that was one of the first things we did is with our asset request process. How do we make it fast? How are we making sure we acknowledge that we've received your request within 1 hour, that yes, we have your request? And how do we still get you that hardware quickly, even though it's a lot? And so you really have to look at your processes, and you have to be flexible with what you need and why. If you're spending 2 days to make sure you appropriately charge back a device to the appropriate cost center right now, it's probably not in the best interest of the organization. I just tell people charge it to my cost center and we'll figure that out after we're done. So I think you do have to move a little quicker than you usually do. And I don't think you can be an IT leader saying, please give me some time. I think you need to look at it and say, how do we move faster? And that's where like that 7-day-a-week schedule comes into place. That's where buying hardware, not hoarding it, but making sure you're buying the hardware you're going to need before you know exactly what you're going to need. Like we know we need these cameras on tops of these computers right here. So if we don't know the number, we know we at least need a few hundred, buy a few hundred while we're waiting to figure out that number.
All right, you might be 2 weeks ahead. What's one thing in the prep process that you wish you had either known or done earlier?
I think knowing how long this would be, I think is probably the most important thing I wish I knew. Because when patient one comes to your state, and I think every state's past this point, so this might not be very helpful for folks that might see this. But when patient one comes in, you're thinking the containment strategy is going to work, and this is going to go away. And so we started planning with a 2-week, 3-week sort of plan, thinking that was going to be sufficient. And a week and a half into this, when you're no longer patient one, but you're a patient 500 that quickly, that's where we realized that this is going to be a new normal for us. And so I think that's the big thing I wish I'd known, because those first few days, our plans were very temporary, right? They were very temporary, a 3-week staffing plan, as opposed to a 3-month staffing plan. And so I think that was the one thing that I wish I had a little bit more insight into. But if you look at how I think, frankly, the whole country went, I think that was everybody's idea was containment was going to hopefully stop this in its tracks. And now I think most people can agree. I don't think there's any stopping this in its tracks. This is about ensuring that if people get sick, they're getting sick at a rate where the existing system can still continue to care for them. And that's what containment's really about. And I wish I had that perspective going into it.
Yeah, it'll be, experience is a great teacher, and so we will have this experience moving forward. But it's hard, right? I talked to Dale Sanders, and he was giving me military analogies, and he said, you don't want to scramble your fighters for every crow that flies by that gets picked up by your radar, and
Sure.
so we're going to have this experience, and the hard thing's going to be for us to not kick into full-blown battle mode when it's something that's really small and manageable, because we have this experience. But on the flip side, we'll have this experience, so we won't take these kinds of warnings lightly, I guess, is the way to look at it.
Absolutely. And as an ex-person for the military, I can appreciate the analogies, and keep your team combat effective, and make sure you're well-resourced, and your logistics and your information's flowing, and all that information keeps your morale high. And with a fully engaged team, there's no limit to what they can accomplish. So keep them engaged, keep being the leader they need to be.
Absolutely. Steve, thanks for your time. I really appreciate it.
No problem. Thank you.
That's all for this show. Special thanks to our channel sponsors, VMware, Starbridge Advisors, Galen Healthcare, Health Lyrics, and Pro Talent Advisors for choosing to invest in developing the next generation of health leaders. If you want to support the fastest growing podcast in the health IT space, the best way to do that is to share it with a peer. Send an email, DM, whatever you do. You can also follow us on social media, subscribe to our YouTube channel. There's a lot of different ways you can support us, but sharing it with a peer is the best. Please check back often, as we will be dropping many more shows until we flatten the curve across the country. Thanks for listening. That's all for now.